A new report from the CDC this afternoon shows binge drinking is on the rise among high school students. Binge drinking is defined as 4 or more drinks for women and 5 or more drinks for men over a short period of time. 25% of those surveyed reported binge drinking in the past month. These levels have not gone down in more than a decade, and drinking too much is the cause of nearly 80,000 deaths in the U.S. every year. Joining us now in studio, Dr. Lisa Lowery from the Helen DeVos Children's Hospital to talk a little bit more about this. What do you think needs to happen here in order to get the message across to our young people? This isn't a new concept or topic, and yet we haven't seen any change. We haven't seen the numbers go down in binge drinking with our adolescents. So can we talk a little bit more about what part they're missing there?
Well, I think our teenagers aren't really realizing that binge drinking is not safe. And a lot of them think, well, if I just binge drink on the weekends, then I don't have a problem. It won't lead to any other risky behaviors. It doesn't lead to alcoholism. But in fact, the opposite is true. It puts you at risk.
Right. Well, let's talk a little bit more about, other than drinking and driving, which they've heard about a lot, I would imagine. Let's talk about some of the physical ramifications that they may experience later in life, and maybe not so later in life, if they continue to binge drink.
Well, binge drinking and alcoholism it affects your mood. It can lead to liver problems, long-term problems with depression, and so it can be a gateway to worsening health issues. It can impair your judgment. So there's a lot of things in just, having those 5 drinks and having that keg of beer on the weekends.
What do you think the key is to getting the message to the kids? What can parents do, for instance?
Well, I think parents need to start having the conversation often, early, and really say, okay, this is how I feel about underage drinking. It's not acceptable. And then also model good behaviors and create a safety zone where kids can come and talk to their parents, especially if they know if their friends are in trouble.
That's true, too. So really opening up that line of communication there, I would imagine, would be pretty important.
It's very important. And it can be more preventative and doing a lot of education. And I think kids really want to hear those messages and clear messages about drinking, safety behaviors, and kids want to know, if I mess up, can I come to you and say that I messed up, and providing that opportunity to have a discussion.
That's good advice.
Thank you.
Dr. Lisa Lowery, thank you so much, from Helen DeVos Children's Hospital.